Good day everyone. I hope you're having a wonderful day. My name is Fanny Doimis from OUM Bangi Learning Center. My student ID number is 940320 125196001 and I'm taking the course of Bachelor Psychology with Honours on the subject of ABPG2203 Introduction to Counselling. Today, I will be presenting on qualities of an effective counselor and ethical communication, the 4 stages of therapeutic listening. Before discussing the 4 stages of therapeutic listening, it is important to understand why listening is one of the most essential skills in counseling. Counseling is not simply about giving advice or solving problems. Instead, it is about helping clients explore their thoughts, feelings, and experiences in a safe and supportive environment. Therapeutic listening allows counselors to understand not only what clients say but also the emotions and meanings behind their words. When clients feel genuinely listened to, they are more likely to trust the counselor, share personal concern openly, and actively participate in a counseling process. Therefore, therapeutic listening forms the foundation on effective communication and plays an important role in building strong therapeutic relationships. An effective counselor requires more than professional knowledge and counseling techniques. They must also demonstrate personal qualities that help clients feel accepted, respected, and understood. One of the most important qualities is empathy, which involves understanding the client's emotion and experience from their perspective. Another is congruence, where the counselor is genuine, honest, and authentic throughout the counseling relationship. In addition, unconditional positive regard means accepting clients without judgment, regardless of their background or personal struggles. Effective counselors should also demonstrate patience, respect, active listening, cultural sensitivity, and professionalism. Together, these qualities create a supportive environment where clients feel comfortable expressing themselves honestly, allowing counseling to become more meaningful and effective. Besides possessing good interpersonal qualities, counselors must communicate ethically in every counseling session. Ethical communication protects clients' rights, strengthens trust, and promotes professional practice. One important principle is confidentiality, which means information shared by clients should remain private unless disclosure is required to prevent serious harm or by law. Counselors must also respect clients' autonomy by allowing them to make their own decisions without pressure or personal influence. Maintaining professional boundaries, using respectful language, and avoiding judgment are essential responsibilities. Counselors should also practice cultural sensitivity because clients come from different backgrounds, beliefs, and experiences. Ethical communication ensures that every client feels respected, valued, and safe throughout the counseling process. Now, let us move to the main focus of this presentation, which is the 4 stages of therapeutic listening. These stages provide a structured framework that helps counselors communicate effectively while building a strong therapeutic relationship with their clients. Rather than simply hearing what a client says, therapeutic listening requires counselors to pay careful attention, understand the client's experiences, respond appropriately, and remember important information throughout the counseling process. The first stage of therapeutic listening is attending. This stage refers to the counselor's ability to give full attention to the client, both verbally and non-verbally. Effective attending involves maintaining appropriate eye contact, using open body posture, showing positive facial expressions, and avoiding distractions during the counseling session. Counselors also use simple verbal encourages such as, "I understand," or "please continue," to show genuine interest in what the client is sharing. Although these behaviors may appear simple, they play a significant role in helping clients feel respected, accepted, and valued. When clients realize that the counselor is fully present and listening attentively, they become more comfortable discussing sensitive issues. As a result, attending becomes the first step in building trust and establishing a strong therapeutic relationship. After giving full attention to the client, the next stage is understanding. At this stage, the counselor attempts to understand not only the client word but also the emotions, thoughts, and personal meanings behind those experiences. Rather than making assumptions or jumping to conclusions, the counselors listen carefully, ask appropriate questions, and clarifies any information that may be unclear. This process allows the counselor to gain a deeper understanding of the client's perspective while demonstrating empathy and respect. For example, if a client says they feel stressed about university, the counselor explores whether the stress comes from academic pressure, family expectation, financial concern, or other personal issues. By understanding the client's situation accurately, counselors are able to provide more appropriate support and develop interventions that truly meet the client's individual needs. Once the counselor understands the client's experiences, the next stage is responding. This stage involves providing responses that demonstrate understanding, encourage further discussion, and help clients explore their concerns more deeply. Effective responses include reflection of feelings, paraphrasing, summarizing, validation, and asking open-ended questions. For example, if a client says, "I feel like I'm not good enough," the counselor might respond, "It sounds like you're being putting a lot of pressure on yourself and that's making you doubt your abilities." Such responses show empathy while encouraging the client to continue sharing. Instead of giving immediate advice or solving the problem, counselors create opportunities for clients to gain greater insight into their own thoughts and emotions. This strengthens both communication and the therapeutic relationship. The final stage of therapeutic listening is remembering. Although it is often overlooked, remembering is essential for maintaining continuity throughout the counseling process. Counselors should remember important information shared during previous sessions, such as significant life events, personal goals, family relationships, or coping strategies discussed earlier. Referring to these details in future sessions shows clients that they have been genuinely heard and valued. For example, a counselor might say, "Last sessions, you mentioned feeling anxious about your presentation. How did it go?" This simple question reassures the client that the counselor remembered their concern and is interested in their progress. As a result, remembering strengthens trust, promotes continuity between sessions, and supports more effective treatment, planning, and long-term counseling outcomes. Now that we have discussed all 4 stages of therapeutic listening, the question is, why are these stages so important? Although each stage has a different purpose, they work together to create effective communication throughout the counseling process. Attending helps counselors give their full attention to clients. Understanding allows them to explore the client's experiences more deeply. Responding encourages meaningful conversations, while remembering strengthens continuity between counseling sessions. When these stages are applied consistently, clients are more likely to feel heard, respected, and understood. As trust develops, clients become more comfortable sharing personal experiences and participating actively in counseling. Ultimately, the 4 stages strengthen the therapeutic alliance, improve communication, and increase the likelihood of positive counseling outcomes. This is why therapeutic listening is considered one of the most important skills every professional counselor should master. To better understand how therapeutic listening works in practice, let us consider a simple example. Imagine a university student who feels anxious about speaking in class because they are afraid of being judged by others. During the counseling session, the counselor first demonstrates attending by giving full attention and observing both verbal and non-verbal communication. Next, the counselor moved to understanding by exploring the student's fears and emotions without making assumptions. The counselor then uses responding by reflecting the student's feelings, asking open-ended questions, and providing validation. Finally, through remembering, the counselor follows up on the student's progress in future sessions and reviews the coping strategies discussed previously. This step-by-step process helps the student build confidence while strengthening the therapeutic relationship. Before I conclude this presentation, I would like to highlight several important points. First, effective counseling depends not only on professional knowledge, but also on strong communication and interpersonal skills. Second, counselors should always practice ethical communication by maintaining confidentiality, respecting clients' autonomy, and demonstrating professionalism throughout the counseling process. Third, therapeutic listening involves 4 important stages: attending, understanding, responding, and remembering. These stages are interconnected and should be practiced together rather than separately. Finally, counselors should remain empathetic, culturally sensitive, and client-centered because every client has unique experiences, needs, and expectations. By combining these qualities with effective therapeutic listening, counselors are better able to establish trust, encourage meaningful conversation, and promote positive counseling outcomes for their clients. In conclusion, therapeutic listening is a fundamental communication skill that supports effective and ethical counseling practice. Throughout this presentation, we have explored the qualities of an effective counselor, the importance of ethical communication, and the 4 stages of therapeutic listening. Although each stage serves a different purpose, together they help counselors build trust, understand clients more accurately, and provide appropriate therapeutic support. Ethical communication further strengthens this process by protecting clients' rights and promoting professionalism. Effective counselors do more than simply listen to words. They listen with empathy, respect, and genuine understanding. By integrating these qualities into every counseling session, counselors can foster stronger therapeutic relationships and support meaningful, positive change in the lives of their clients. That's all for today's presentation. Thank you for listening.